Itraconazole, also known as Sporanox, is a medication used to treat different types of fungal infections. It is part of a group of drugs called azole antifungals, and it works by preventing the growth of fungi. This medication can be taken with or without food, usually once or twice a day as directed by your doctor. It is important to take it at the same time each day. The dosage and length of treatment will depend on your medical condition and response to treatment. Be sure to follow your doctor's instructions carefully, and do not stop taking it without consulting your doctor. Before you start taking Sporanox Capsule, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with a full meal as directed by your doctor, usually once or twice daily. Remember to swallow the capsules whole. It is important to take Sporanox Capsule 2 hours before or 1 hour after antacids, as antacids may decrease the absorption of this medication. If you have decreased or no stomach acid, or if you take drugs that decrease stomach acid, consult your doctor or pharmacist for more details on how to take this medication. The dosage and length of treatment are based on your medical condition and response to treatment. Take this medication exactly as prescribed by your doctor. Some conditions may require you to take this medication in cycles. For the best effect, take Sporanox Capsule at evenly spaced times every day. Remember to continue taking it until the full prescribed amount is finished, even if symptoms disappear. Do not switch between different forms or brands of this drug without your doctor's direction. Remember to tell your doctor if your condition does not get better or if it gets worse. Some common side effects of Sporanox Capsule may include nausea, vomiting, diarrhea, headache, stomach upset, or dizziness. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects such as numbness or tingling in the arms or legs, hearing loss, or mental/mood changes like depression. In rare cases, Itraconazole, the active ingredient in Sporanox, may cause very serious liver disease. If you develop symptoms such as nausea or vomiting that won't stop, loss of appetite, abdominal pain, yellowing of the eyes or skin, or dark urine, it's important to contact your doctor right away. Itraconazole can also cause a mild rash, which is usually not serious. However, if you develop any rash, it's important to seek medical help as it may be a sign of a severe allergic reaction. While very serious allergic reactions to this drug are rare, it's important to get medical help right away if you experience symptoms such as rash, itching or swelling of the face, tongue or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not listed, it's crucial to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. If you have a history of heart failure, Itraconazole should not be used to treat fungal nail infections. It may rarely cause or worsen heart failure. Contact your doctor immediately if you experience symptoms such as shortness of breath, swelling ankles/feet, unusual tiredness, or sudden unexplained weight gain. This medication can slow down the removal of other medications from your body, which may cause very serious side effects to occur. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Before taking Sporanox Capsule, make sure to inform your doctor or pharmacist about any allergies you may have, especially to other antifungal medications. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Additionally, be sure to inform your doctor or pharmacist about your medical history, including any liver, kidney, heart, or lung disease, as well as any history of decreased stomach acid. It's important to note that Sporanox Capsule may cause dizziness, especially when combined with alcohol or marijuana. It's best to avoid these substances and refrain from driving or operating machinery until you know how this medication affects you. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications you are taking, including Sporanox Capsule. For older adults, it's important to be aware that there may be a greater risk of hearing loss while using this medication. If you are pregnant or breastfeeding, it's crucial to discuss the risks and benefits of using Sporanox Capsule with your doctor. This medication may harm an unborn baby and can pass into breast milk, so be sure to consult your doctor before using it during pregnancy or while breastfeeding. Additionally, if you are of childbearing age, it's recommended to start this medication a few days after the start of your period to ensure that you are not pregnant, and to use reliable forms of birth control while taking this medication and for 2 months after stopping treatment. It's important to note that Sporanox Capsule may interact with other medications, potentially affecting how it works or increasing the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Itraconazole, the active ingredient in Sporanox Capsule, interacts with many medications, so it's important to be aware of potential interactions. Additionally, other medications can affect the removal of itraconazole from your body, which may impact its effectiveness. Examples of such medications include efavirenz, isoniazid, nevirapine, rifamycins, such as rifabutin, and certain drugs used to treat seizures, among others. When taking Sporanox Capsule, it's essential to follow your doctor's instructions regarding dosage and timing for optimal results. Be sure to discuss any concerns with your healthcare professional. If someone has taken too much Sporanox and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222, and Canadian residents can reach out to a provincial poison control center. Remember, it's important not to share this medication with others. Sporanox Capsule has been prescribed for your specific condition. It's important not to use it later to treat or prevent another infection unless your doctor instructs you to do so. Before starting this medication and while taking it, you may need to undergo lab and/or medical tests, such as liver function tests. Make sure to attend all your medical and lab appointments. For more details, consult your doctor. If you forget to take a dose of Sporanox, take it as soon as you remember. If it's close to your next scheduled dose, just skip the missed dose and take the next one at your regular time. Do not take double the dose to make up for the missed one. When storing Sporanox capsules, make sure to keep them at room temperature and away from light and moisture. It's important to store them in a safe place, away from children and pets. When it comes to disposing of the medication, it's important to do so properly. Don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.